As of February 2026, there's an ongoing outbreak of measles in the state of South Carolina, and according to the CDC, over 500 people have been infected in the state this year. What's caused this nearly forgotten infectious disease to come back with such ferocity? The main driving factor behind it is a decline in people vaccinating themselves and their children against measles. According to Dr. Carlos Del Rio in an interview with NPR, these outbreaks happen when population vaccination rates fall below 95%, and in South Carolina, school age kids, this rate is 92%. Currently, there is a growing number of people in the US who are skeptical of vaccines or who refuse to get them for themselves and their children. This anti vax movement has a variety of factors fueling it, including online misinformation and more people wanting autonomy over their medical decisions. As vaccine hesitancy continues to rise, there will certainly be an increase in bad consequences for both individuals and communities. Hopefully, this presentation will inform you on vaccine hesitancy, the factors that are contributing to its rise, and the potential hazards it poses. For more than a century, vaccines have been used across the globe to prevent disease or limit its severity. In doing so, many countries like the US, where most children are vaccinated, have eradicated diseases like measles, polio, and chickenpox. In doing so, many generations have never had to suffer these ailments or even fear them in the first place. However, these high vaccination rates seem to be on the decline. More Americans than ever are skeptical of the safety or efficacy of vaccines, and as a result, the number of Americans choosing to vaccinate themselves and their children is declining. A study by the CDC found that children born in 2020 to 2021 had lower vaccination rates at 24 months compared to children born in 2018 and 2019. Additionally, in 2025, the CDC published a report on kindergarten vaccinations like MMR and DTaP and found that vaccination rates fell for all vaccines compared to the previous year. You may be asking, what's causing this decline? According to a 2022 paper in the journal Clinical and Translational Sciences, anti-vax populations mistrust the safety and efficacy of vaccines, as well as the people who develop, distribute, and recommend them. The cause of this growing mistrust is multifaceted, with different people choosing to refuse them for a variety of reasons. One major factor that drove this increase of anti-vax messaging was the usage of social media to spread anti-vax misinformation. Accounts can make videos, posts, or memes that mischaracterize vaccines or the healthcare community, allowing them to broadly sow distrust. Many of these anti-vax posts are specifically targeted towards demographics that have historically been taken advantage of or tested on by medical institutions in the past. These posts try to compare vaccines to atrocities like the Tuskegee syphilis study, and in doing so, create suspicion against vaccines in the healthcare community. Another factor that compelled many people to the anti-vax message was increasing mandates for school immunizations, regardless of belief-based exemptions. Many parents felt like they should have the freedom to choose whether their children get vaccinated, and that it was an overreach of their rights to limit that. This concern over infringement on personal rights also helped spread the anti-vax message to right-wing communities. These factors would only be exacerbated by the COVID-19 pandemic and vaccine. Social media misinformation spread like wildfire, making many question the necessity and safety of these vaccines. In addition, vaccine mandates made many people upset at wanting to have more autonomy over their medical decisions. As a result of the pandemic, more people than ever were exposed to anti-vaccine messaging, and more people than ever were unsure about vaccines and the safety of them. As vaccine hesitancy continues to rise, there are certain to be widespread consequences. If population vaccine rates continue to decline, outbreaks like the one we're seeing in South Carolina will continue to become more common. And some of these infections could even become endemic in the population, meaning that they remain there continuously and occur regularly. Many of these illnesses cause mild to moderate illness in the majority of people infected, but in a small percentage, they will cause disability and death. That means that if these diseases like measles or polio become common again, with millions of people getting infected a year, thousands will be paralyzed and dead. And not getting vaccinated also harms those that are vaccinated. Many vaccines provide good coverage against infection, but it's not total. So if there's many unvaccinated people that are sick around you, they can get vaccinated people sick too. Finally, growing unvaccinated populations pose a serious risk for immunocompromised people and or those that can't get vaccines because of medical reasons. These groups are at incredibly high risk for complications from even mild infections, let alone high-risk diseases like measles. For these individuals, the only protection they can get is from preventative measures by the community, like getting vaccinated and staying away when ill. Today, I've addressed the growing trends of vaccine hesitancy, what might be driving this growing trend, and the potential hazards it has to individuals and the community. Vaccines are integral to modern health as we know it, and they've freed us of many nightmares, including smallpox, and have limited the damage that diseases like measles, polio, and tetanus could have done to us. Vaccine hesitancy is a complex issue that affects everyone, regardless of their vaccine status.